you all had a wonderful Thanksgiving, some family time.
We don't have any resolutions, so.
I'll start with looking for an approval of the minutes.
Take a motion.
Any changes? Okay, all those in favor?
Aye.
Any opposed? Okay, yeah. HS1 is a resolution awarding professional services contract for nutritional services. And this is lump sum $63,375 for 39 weeks, 25 hours per week at an hourly rate of $65. And we now have the RFP evaluation in the packet, as well as Beth's resume. So I'll look for a motion and then we'll discuss.
I'll make the motion.
Second. All right, got lots of seconds. Sarah, you want to speak to this a little bit?
Sure. We had been awarded a SHINE SNAP Ed education grant back in 2019, late in 2019. Part of the process is you have to have a nutrition educator, somebody who is a certified nutritionist. We have put it out at that time in early 2020, request for proposal. Didn't have good luck with it. So then Cornell Cooperative Extension was going to perform the services. The contract was never signed, so we've never been able to do any of these services. We put it out again, modified the language a little bit more. It's not really a full-time job, so modified the number of hours anticipated to do the work with this grant, and we did get respondents. This is providing SNAP Ed education, which is focusing on seniors or the elderly.
Thank you.
And they'll be doing workshops as well as having at least 2 food box distributions and doing community fair, health fairs as well, providing nutrition education to our seniors.
Any questions? All right, all those in favor?
Aye.
Any opposed?
Thank you.
Thank you. HS2 is a resolution authorizing budget modification Department of Social Services for on-call holiday premium. I'll look for a motion to discuss.
Motion. Second.
Stacy, you want to speak to this?
CSEA finalized their contract. It provided a bit of a bump up, so we're running short of money. In order to do the on-call, they get a little more money when they are covering Thanksgiving, Christmas, holidays.
Okay, any questions? All those in favor?
Aye.
Any opposed? Motion passes, thank you. All right, committee review and decisions, the Camp Zerby proposals, Read Bureau. This is the packet of about $350,000 worth of work. We are not going to move anything today or do a capital project on this today if we agree on it. Well, we have the opportunity to ask any questions about it. Brian? Did you want to address any highlights, Brian?
When we looked at it, a few different opportunities to take the property and how we can reach the most people there and what improvements we could make that would be long-lasting and add to the outdoor recreational opportunities for the county. You've all heard in the past the bathhouse is long needed to go along with the lodge, and that also can be used in other pieces of it, such as with the cabins being converted into rental properties on a campground. Those things, go along with the bathhouse. The trail system has been long overdue. Been, looking back at my notes, I think Dave and I were talking about this, 7, 8 years ago. I mean, it's something that's still to be looked at, and there's a lot to that, but any way we can, look to take advantage of developing, over 500 acres, then that would be beneficial. And then, we talked about, again, in the past, looking at putting together that new rifle pistol range, and that would benefit, again, other areas within the county, law enforcement and such, to be able to have a facility on site that would be state-of-the-art and a great training opportunity within our own backyard. Yeah, it will work with the property out there. So mainly all that being identified in there are things that we've talked about in the past, but really would take the property and bring it to the next level, in my opinion, and be something that we could use and develop and continue to grow with.
The proposal for the bathhouse that's there, that we have now, does that include access to persons with disabilities?
Yes.
Yes. Well, he knows better.
I do.
Just making sure.
The current one really doesn't meet those.
The current
one does not.
I know.
The current one does not.
No, it does not.
And it's also, this is gonna be much closer to the main
No.
Yep.
building.
Yeah, the original thought was to be pretty close, right next to it, where the old one used to be, so very close. I don't think we can attach it, but
You might get away with a,
Go ahead, Herb.
go ahead, Rick.
There was a drawing that actually attached it. It was like, gonna be like a breezeway from there out to the bathroom itself. And the Bills and Grounds said they looked at that, there's a drawing on it. And, I think he didn't know if they could, and neither did Phil, if he could actually attach it to this building, to the main building, but they're gonna try it because of, individuals with wheelchairs and stuff like that. It'd be a lot easier if they could just be in the building and wanna walk right up to it. So, there is a drawing on that.
Does that cause us any problems with any of the historic preservation money?
Well, that's what you gotta look at.
that's why I don't think we can attach.
It does.
There was one there, if I'm correct.
Yeah, it wasn't attached though, the original
It
one.
was right near it,
Right.
it got destroyed, I guess.
I would think as long as it didn't change the existing structure of the building, I would almost think it would be acceptable.
Dave Turner, you have an opinion on that otherwise though?
Yeah,
Well, because the renovations to the lot were funded with preservation dollars, you pretty much have to get everything approved by the SHPO office. And there's probably some engineering solution that could create access without actually physically changing the main structure. But like a full-on hallway type of attachment even, I think it is gonna be difficult, but I think you'll find, you get creative, you'll find something that's close enough that SHPO will buy, but it's not gonna be a easy or quick process.
So funding for this, Brian, what's proposed other than what we already see as 2023 county budget from ARPA?
Well, that's what we did. We applied for some of these improvements through ARPA, and then the rest of it was put together based upon a request for me to submit a proposal of what we would like to do and where we would go forward. Being that we currently have a grant with Parks and Rec right now, I mean, I don't know, Dave, you can correct me if I'm wrong, I think it would be a struggle for them to fund us 2 open grants at one point in time. So I have not applied to Parks and Rec on this project.
Which project is open?
Hollis.
Hollis, yeah, okay.
Any other questions?
No, I would just comment, I was here during the restoration of the main, and that was a process. I mean, it took forever to get that done, and you were a great leader in trying to keep people focused on this.
Sign that.
This is good though.
Give it back.
It's about time.
Yeah.
You know,
I think anytime, Jim, you get involved with the historical preservations, it becomes, it's doable, but it's a process, there's no question about it.
I thought at one point he'd probably walk away from all of it, 'cause
Right.
it was a battle.
I
was
think
involved in that.
I think this overall project is a good one, and we should proceed with it.
It's about time with Serbia. I think that there's a lot of potential there.
I think too that you look at, like even like a rentals at Serby, they're actually busy as a house and the need is there. And then we continuously get calls for everything that we've talked about as being additional things that people are looking for. Overnight lodging, use of the facilities in the wintertime, and different things that could be done with these upgrades. And then obviously for anybody who's attended an event out to Camp Serby in the main lodge, the restrooms are a little bit of a walk right now.
So how often is the lodge rented now? Is that,
From the
Fairly
rental
steady?
period of May, through May through November, I would say almost every weekend.
almost every weekend? Because my thought is at some point, and I know you can't attach it and do it because of what we went through, but it would almost make sense to think of a cooking kitchen right near it.
Yeah.
Because you've got people that are catering food in, and I don't know if that would help the potential of it, but if you're renting it every weekend now,
Right.
Probably not a need to do that, but sometime down the road.
Mhm. Yep.
I think the more inventive we get, the better return is on that.
I agree.
Any other discussion?
One question.
Go ahead.
Project 4 of the camping sites.
Yep.
You're saying that a shower accommodations, bathhouse would need to occur in conjunction. Will that be near that site
No,
separately?
they would use the one we're building.
Oh,
It would be the same one. So
Okay.
that would be, that bathhouse would have showers and
and that's usually, that's just really tents, pretty much?
Yeah, so it'd be like a non-electric, non-water sites. So pretty just your cleared area, your fire pit, fenced area.
Well, what they call wilderness campsites.
Yeah.
Although we did talk about, originally a few years ago, we did talk about possibly having a couple up near the parking lot electric sites based on, we get RVs all the time that want to come in there and the big ones, and we can't, there's nowhere for them to plug in or anything. So, but it was discussed at one point in time.
Another wish list.
Yeah.
Nothing wrong with that.
Right, and then the two cabins we have sitting out there right now, they just need some renovations and they can become a rental unit as well, so.
All right, we're all set for now. We'll be,
Thank you.
I talked to Phil about possibly doing creating a capital project, but we're gonna figure out where
Okay.
money's coming from, I think, first. We'll probably, we may be able to do that before the end of December if we need to, or else it'll just wait until January. Okay, on to ARPA projects. We're gonna start with the YMCA of Fulton, basically a daycare program, Dave, is it not?
Yeah, they have some space and it just needs improvements in order to be consistent with the requirements that oversight agencies demand for these type of facilities. And the need, I think we all know the need is there, and they're doing a good job with the program they already have. This just will allow them to take on some more kids. Hopefully allow some more parents to go back to work.
Does anybody have any questions regarding this project?
Sounds like a good project to me.
Yeah.
It's a huge need in the county, obviously. Okay, I'm gonna make a motion to move to go ahead and approve that program. Since
I'll second that.
a second.
Yeah.
Any discussion? All those in favor?
Aye.
Any opposed? Okay, second project is the Thank a Service Member.
Yeah, this is a small not-for-profit. They've been around for a while. They're focused specifically on veterans and various really kind of unique support services for them. Eric, I don't know if you had any experience with them at all, or?
I have not, actually.
Okay.
That's why I'm writing it down right now.
Yeah, so they're kind of boutique type of service programs. You don't find them everywhere. You know, they're not the typical thing that like even Eric's team might be putting together. But they are registered not-for-profit in New York, and they requested 50 grand to help cover their loss of revenue from their typical fundraisings. Very much the same request we get from a lot of not-for-profits. When COVID was in place, none of their donors were present, and they're having a hard time getting some of them back on the list again. So they need support to continue to provide the services that they had been prior to the pandemic.
Do you know if they have a local presence?
They're based out of Oswego, yeah.
They're based out of, that's the Oswego address.
Was that the group that had there was something at the harbor they had going on last summer?
Yeah.
Is that
I
the same
think
group?
that was, yeah.
They took a bunch of vets, out to the lighthouse, I think, or something?
Yeah, they do activities at the fort on their grounds a lot. Peter Allen is the person that runs it.
There was some discussion that there was a 50,000 threshold that was made it harder. Is it 50,000 and less, or is it $49,999?
So 50 and above is a different reporting category than 49 and below, which is why some of the ones that have come through previously, like Fulton Block Builders and ORA and a couple others were 49.9.
Arise was 49.
Arise.
Are they aware of that? I mean, would it make sense for us to just drop them $1?
I think we should.
Yeah, you're welcome to
We should just
do
drop it.
whatever you
It
want.
does make
This
it
is-
easier if
yeah.
you're underneath that.
This is what they asked for. Some people that we've shared that with said, okay, we'll change our request.
Well, we could change it right here if we want.
We can absolutely change it right now.
You can change it to $1 right now.
Is that an amendment? Did we
We
a
don't
motion?
have to amend it, we would just make it, we would just approve it at 49,999.
Yeah, the numbers before you are two sources. One, what did the applicant request? And two, what has been suggested by the task force who kind of vets them before they come to you. But neither of those is locked into anything. You guys make the decision about how much you want to give them, if anything.
What I'm saying is you already had a motion in a second.
Yeah, let's.
No, we
let's
had,
drop it by 10.
no, we did not have a motion in a second
Yeah,
on this one.
no,
We already had it.
We've just been discussing that on the
Someone
project,
could just motion.
since it's not a resolution on the agenda.
Okay, so
If you have-
I'll make a motion that we approve at 49,999.
So-
99.
Right. No, do you want to just drop them a cent?
No,
Or a
49,999.
whole $1?
$1.
Okay, so do we have a second on that?
I'll second that.
Any other discussion? All those in favor?
Aye.
Any opposed? All right.
Yeah, I don't know who the 2 or 3 people were, but after we did Arise, I came to the next legislative meeting, and there was 4 $1 bills laying on the desk.
Okay.
All right, well, Dave, you can check out if you want then too. We're not going to discuss any other ARPA stuff.
Okay, thank you.
Reporting, start with Veterans Services. Yeah, go ahead. There's no more, I don't believe we'll have any more votes.
Let's vote about you.
Things are going well. Our veteran informational event that we had back in November didn't go as well as we had hoped, but our call-in appointments are starting to pick up, though our walk-ins have stepped down. And I believe that's just because of the weather, the way things have changed. I spoke with the individual at the outpatient clinic, and we are a go for that. So starting in January, the first and second Thursday we will be in Pulaski, one of the three of us. And then the second and third Thursday of every month, we will be at the Oswego Outpatient Clinic. I think it's going to benefit the veterans greatly because there's a lot of them that get referred to us from the clinic. And some of these are limited on how often they can get out or how difficult it is for them to come visit us in the office. So if we could catch them right there, we're going to have the ability to bring them in, talk to them about their benefits, file the benefits right then and there if we can. If not, we can do the 2122s so that we can become the POAs for them. So there's a lot that we're going to be able to get done right there in that office. So we're really looking forward to that. As far as the Horton, we're still waiting on training dates for him. I've contacted both the American Legion as well as the New York State. And I have not heard back yet of a date that they're going to be able to start training him. And I'm still waiting on the VA for my accreditation, which they told me could take anywhere from 3 to 6 months from when I completed the training.
Wow.
So it's just like any other thing that goes to the VA. It's got its channels it's got to go through. It depends on who gets it, on how fast, how lucky they feel that day. So we're still waiting on that to come back. That's going to put a little bit of a damper on the Pulaski and the Oswego deal because Matthias is still the only VSO we have. So he's the only one authorized to put his name on the 2122s.
Right.
So hopefully that gets remedied quickly. We got the mental hygiene networking meeting that's coming up. There's been a lot of people that have reached out with things that they get wind of. One is the VNCP, which is the Veterans Nonprofit Capital Program that the state runs. There's $5 million in that program that nonprofit organizations can apply for. Both David Owens and Vera Dunsmore sent me that information, so I take that information and I envelope it up and I send it to all the VFWs and all the American Legions in the county. Especially the American Legions, they seem to be the ones that are hurting the most. I just found out the American Legion in Minetto shut down. They're no longer, and that seems to be something that's going to start happening a lot. Just from my experience, I'm part of the one in Fulton, and when we go to the meetings in Fulton, we're lucky if there's enough people for them to even have a meeting. So these things are starting to dwindle out. So our office, though we're not an outreach program, that's something that we have to explain to people. We don't do outreach. What we do is we help apply for benefits. We provide a service, but that's no reason for us to not have that outreach information for them. So we're going to start trying to find things such as Clear Path for veterans. Because I think the issue with the American Legion is they're just not getting the young people in. The older veterans are starting to just get too old. They're starting to pass away. And then you have the younger veterans who just really aren't interested in something such as the American Legion. Unfortunately, a lot of that has to do with the fact that a lot of them don't have bars. A lot of veterans like to drink, they like to hang out, and the American Legions, a lot of them don't have that. So they're not able to get the people in the office. So we're going to start looking for ways to get the younger veterans involved by posting that information as we get it in our office and providing it to them. Other than that, that's really, everything's still going good. It'd just be great if we can get the VSO accreditation thing done. That's really the only thing that's holding us back.
How are you doing with the advisory committee? Is have we already staffed? Have we had a meeting yet?
No. I meant to ask about that a couple meetings ago. I've heard nothing. Since the first meeting we talked about it and we voted for it to happen, I haven't heard a word from anybody. So I was going to ask who is heading that up, who's going to be in charge of contacting everybody,
Well, I was put on the committee, but I'd never been to a meeting.
Well, that's the thing. Who on the committee is to schedule these meetings? Who's the president, or who's in charge, or who's? Because nobody's reached out to me either, and that's where my question came in.
I think the chairman asked Mike to be chair, and last I heard, we assembled a list of people who were willing to serve. So talk to Betsy about that list, and
I thought
maybe
Brad Hughes worked on it, but I hadn't heard from him last month or so.
so maybe if we have some ideas, about how to get people more involved. I mean, I know the Legion down in Cleveland is really
So it's one plastic.
pretty hopping.
The one
pretty
plastic is hurting too.
Yeah,
W
yeah.
is almost closing the doors the same.
Correct. That seems to be the going thing, and unfortunately, what I see in the future is the American Legion, even the nationwide, at this point, they're not even able to provide us that VSO training. We're getting that training through the state, and the American Legion is kind of piggybacking on that. So once we're accredited, we're dual accredited with the American Legion and with the state. Now, the Legion, the last time I spoke with them, they are trying to bring that back, but I think the membership just isn't there. The money's not there.
Right.
So it's going to continue to suffer, I believe, and unfortunately, I think probably after I've left, but I think it's just going to go away. The American Legion's not going to exist anymore.
So, what's involved with Minetto? I mean, shutting down, they just,
It was funding, I believe. The only way I found out was I was verifying all my addresses and phone numbers on my website. And when I tried to locate their building, I found a letter they wrote to the town stating that what they had done with their money and that they were no longer, they didn't exist anymore. They ceased to exist.
did they own property?
No, their meetings and everything were done right out of town hall.
Okay.
The plastic owns their own building.
Yeah, last guy, their building's huge too. I've been in there. I painted their kitchen actually at one point in time. So, but again, it's some days you drive by there and there's not a soul for weeks, and then one day and the parking lot's full.
Well,
it's
the
a hit or
parking lot's
miss.
full because they're using that parking lot, the milk of people who are putting addition and doing work at the center right up, just up the street. So all those people, at the medical center, they're all parking in the American Legion because they're redoing that whole area.
Oh, okay. Well, they do the voting there too, I
Same question.
believe, so. But, I mean, I've had one, and I believe it was Costanza. When I joined the Legion, I joined online, so it just makes you a state. And I had one Legion president actually reach out to me. But by the time I heard from them, I had already reached out to Donna Kessner, who is part of the Fulton Legion, and transferred my membership to that one. So just to give you an idea of all the legions there are, I think there's 11 total, or there was. I heard from one. And the word I'm getting from what I'm finding out is they don't really get along. The legions don't get along with each other, nor do the VFWs, and the VFWs and the legions don't get along. So there's this animosity out there, which is unfortunate because like the Sandy Creek, Pulaski, I mean, they could do a lot together if they could just, put their differences aside or whatever the issue is. I don't know that that's a ring I want to throw my hat into to try to fix that, but I mean, it's unfortunate when you have, Minetto's out there all by themselves and now they cease to exist.
So after the meeting, when I get together? After this meeting here?
Yeah, absolutely. Yeah, I have time.
Oh, I'll talk to you another time, but let's follow up on the BIC, the advisory committee.
I was supposed to meet with Brad, and I just, we haven't hooked up, so I'll get
Right.
back.
Oh, check with Betsy. I'm pretty sure she can get you a list of people who are willing to be members.
We can.
Okay.
Yeah.
Go ahead.
So I would tell you on the event at the Elks, do not give up on that. I think that had a very limited spread of people that knew about it. So after conversations, we had quite a few people that said, I had no idea. Maybe the agencies that are attending that can help. If you get your flyer out way ahead of time. It was a good event for talking to other agencies, and there were some people there that we had talked to, we weren't aware of what they did. They were not aware of what we do. So I was very impressed with that. I think that if you push that button again and get others involved, get the press involved, I think you'll find that there will be some attendance to that, and it may grow from that point. But your mix of people was right. It nailed it right on the head.
And I don't want to take any credit for that now because that was done by No Hygiene. They did a great job on
That's
that.
fine, but it's still VA.
Right, and by no means do I think we should not do those. Again, I think it falls back, because the part that I played is a month before this thing, I sent flyers to every VFW, to every American Legion. What they're doing with those flyers, I don't know. That's why I went back in and said, well, let me check these addresses to make sure that they're actually getting them. And when I went to my last Fulton meeting, they were like, oh, yeah, we got your flyer.
That if we'd have got a flyer, we have mass email. And we would have shot that out to everybody. Whether you're a veteran or not, they may know the vet, they may have a vet in the family. We just take that, boom, it's out. And it's out to 900 different email addresses. And I think some of the people that were sitting at the tables have that same capability for you. Even though I know it wasn't your event, it was for your people.
Right.
So, and it's not a criticism, because I think the event was tailored right. It just didn't draw the attendance that everybody kind of thought would be there. And I would hope that people would attend again. But I would tell them that also. Don't back away from that yet. First time is not always the best shot. The other thing I want to let you know is, if you've got grants for VAs, we have only, because we didn't get a lot of money about 6 years ago, we have 2 ramps that are dedicated to veterans. We have ramps that are dedicated to OFA. We have a ramp dedicated to Catholic Charities. So if there's funding out there, application, and you share that, if that's that kind of an application where nonprofits can apply, we can apply to get another 5 or 6 ramps that are dedicated to just veterans. Because a vet coming out now, they will give them a ramp. A vet that was in Vietnam, following, they don't get that. It's a battle to get them to get veterans to pay for a ramp for them. So we fill that in pretty quick. So if you want to share that, then we can take a look at that and work with you. And please keep in mind also, and DSS the same thing, we have 6 Christmas baskets dedicated to veterans that you have to give us names, number of adults, number of children. I don't need their name, I need their initials. And the Army, National Guard, Reserve recruiters will bring them baskets to your office for either distribution or pickup. But if you don't provide them, don't call me the last day and say.
Right, well, and when you said that the last time I spoke with you, I actually had some names, and then I reached out, I sent you an email, I don't know if you got it or not, because I don't know who to report those to. So I was sending an email just, okay, who do I turn these names into? And I didn't receive a response. So let me make sure that I have the correct email, and then that way I do.
I can give it to you right now, it's really easy. It's JL Karasek, KARASEK, at ariseinc.org.
Yeah, we actually have some names set aside. They're on my desk right now.
If you have more than 6, let me know, because I've got funders that.
I can get you more than 6. We've had a couple veterans come in. One was homeless. One was.
You tell me what you
got a
need.
job and stuff. So these are people that really could use the baskets for sure.
Okay. And you know the game. And you know the game.
Now, December 1st, we have Clear Path for Veterans is holding a mobile canteen at the same location. That flyer went out as well, so we're hoping that there's a bigger turnout for that. I have yet, they hold one every Wednesday in Chittenango, and it's open to all veterans. It's free. You just have to drive out there, and I know Matthias has been to one. I haven't had the opportunity to go out there as of yet, but I'm looking forward to the December 1st one here locally. So they've really done, I don't want to say they've done a lot, but they've stayed in contact a lot with myself and dental hygiene and things like that. They're really trying to get something going here in Oswego County.
Nice.
So hopefully we get a bigger turnout. I'm going to make sure that one or more of us is at that event.
Okay.
So.
Okay, any other questions for Eric? All right, thank you. Brian, you're up.
All right, we'll update our large infrastructure grants are moving forward. At House, we have the CFA for the lodge, and At Holliston Independence Trail, we have the Ready Shoreline Improvement Grants. All of those are moving forward with, hopefully construction, in, the Hollis Lodge has started, but the other two, hopefully construction in the spring will be going on to, lake projects. Our camp registration for both Hollis and Zerby opens January 1, and that's also when we'll start hiring. So if anybody knows anybody looking for summer jobs. Friends Camp Hollis is going to have a 5K this year in June. It'll be a fundraiser for them as they pay for a lot of kids to go to camp and etc. Our AmeriCorps program opened its 26th year on November 1st, so they're moving along. Our Christmas tree lighting for the city of Oswego was this past weekend. That was a big event that went well. We work with Fulton with theirs coming up as well. Our Read It Club started again in October. For those of us that are a couple years older, that's the same as the Book It Club that Pizza Hut used to do, but Read It, we do it through the press box here in Oswego, and that's been the same theory, getting kids to read books. Our Youth Advisory Council is working on Christmas cards for seniors, and they're also discussing a dance in December. We have a free movie coming up on Saturday here in Oswego for 150 youth, and it's basically Strange World, which is a new movie coming out, so that's a free movie. We're working with the city of Fulton this year for a holiday Christmas party. It'll be their first one, so that's an event that's in the planning works to go forward. New York State finally approved our resource allocation plan last month, which is usually done in March, and so that gives us the opportunity now to pay our claims and move forward. As we roll into accepting applications for 2023, which are due next week. So almost a little bit of a gap there. In our Governor's Youth Council, we have two proposals moving forward. On December 7th, we'll be presenting to the state, the governor's office and OCFS. So that will be good, and stay tuned to see how they do with that, with their policy recommendations that they've been working hard on. So keeping busy and moving into the holiday season, which will, again, like everybody else, shift gears a little bit more with our opportunities for our young people. It's all good.
Thank you. Questions for Brian? Alrighty, Sarah, you are up.
Okay, well, I did send out my update of items just to highlight them. Our Disability and Aging Awareness event is Wednesday at City BOCES. We do still have space, so if anybody would like to come and hear, I'll be speaking. Tom Reynolds, who is our contracted legal service provider, as well as a representative from Oswego Industries, will also be speaking about the different arms and how to age in place with a disability at home. And city students will be doing some little light refreshments for us, as well as their safety students will be, their public safety students will be directing people where to go, because I don't know if you've ever been to city, sometimes it can be a little confusing on where you need to be. So it's a partnership with them. We're, our Santa for Seniors program, we're hoping to get 100 nominations for seniors. We received almost 200, so we are going to be very busy coming up soon to get gifts delivered out to all of the seniors. We did have enough people that adopted them, so we're not concerned, and because we had so many adopters, we didn't end it. We just said if there's people that can adopt seniors and there's seniors that want to participate in the program, we will connect them together and get those gifts out to them. So we're, if you come up in the hallway up in our building, you're probably going to see the hall is going to be just loaded with gifts as we get closer to delivering them. Our curb-to-curb transportation, you may hear that some rides have been denied. That is because there's not backup drivers at OCO. They have a lack of drivers for the buses, so they have prioritized the trips to, doctor's appointments, grocery shopping, and trips to the pharmacy. So some social engagements may have been canceled due to the quantity of the number of trips that are being requested, as well as not having drivers to be able to provide those trips. Just as reference, January through June, the average monthly one-way trips is 233. July through October, the average was 391. So it did jump up tremendous, pretty big jump. We did contract, we're anticipating 275 trips per month. We are able to cover the cost of the additional trips, but it's not built within OCO transportation to be able to accommodate those trips. So it's not a function of funding or finance. It really is a function of being able to accommodate it.
They are meeting the contract.
They are,
Okay.
yes, and then some, yes.
Okay.
And we'll be meeting with Gary to see if we need to make any changes to the contract for the new year as well. Gary from OCO Transportation. We did just conclude our public hearings as part of our funding that we received from the State Office for the Aging. We have to have public hearings to get comment from our participants or their family members, anybody in the community, to look at our plan for services for the coming year, get their comment on whether they think it's a good plan, if they see any gaps, if they have suggestions. Most all the comments were very complimentary. Some of the items, though, that did stick out in my mind: transportation to doctor's appointments outside of the county. While they were very complimentary and grateful for the additional trips with the curb to curb, curb to curb does not go outside of Oswego County. So the outside of county doctor's appointments, they still struggle to get them at a reasonable rate. Also, the cost of the newspaper. So the public hearings are posted in the newspapers, and a lot of other items, press releases go out in the newspaper, but the cost of the newspaper has skyrocketed, so a lot of them are canceling their subscriptions. So they're requesting another way to try to get the information out to them. While they are becoming more computer savvy, still that is a hurdle for some people as well, so we have to find a way to get information out to them in a different manner. And the other thing they had mentioned, the vegetables that they receive in their meals are hard. Because we provide meals chilled, we can't overcook them because they are reheating them. So they are al dente, and if they don't cook them long enough, they will be a little hard. On the flip side of that, when we were doing hot meals, they said the vegetables were soggy. So we are going to be putting out monthly with their meals, stating, if your vegetables are hard, try to take them out of the container, add a little bit of water, and cook them for a little bit longer period of time. So we're addressing that. We are also gearing up for the last push for open enrollment for Medicare. It ends on the 7th, December 7th. We have been able to address every phone call that has come in. We do have the 2 relatively brand new HICOP counselors. This is their first season doing insurance counseling. All of our in-person appointments have been booked, but we are following up with anybody who's calling to make sure, see if we can assist them over the phone, through email, through postal mail. If they want an actual in-person appointment, we are working with the State Office for the Aging for them to connect to other agencies that they're contracted with to get that in-person touch.
Is that the program that ends December 7th?
Yes, Medicare open enrollment, yeah.
Good. All right.
But we are also asking people, well, is it just a Medicare Part D? Do you have an Advantage plan? Do you have other insurance? Do you have extra help? Because some people have extended or after the December 7th. So anybody who absolutely has to make a decision by December 7th, we're trying to assist. Other people, we're trying to delay them to get them the assistance after the 7th.
I don't know how they're gonna fill time on television once all those commercials are gone.
Oh, I'm sure they'll come up with something.
Most office doesn't, business too.
And the last item I have is Habitat for Humanity reached out to Office for the Aging to work together with us. They're putting in a grant request for ARPA funds for aging in place. And they're looking to tackle repairs, which has been a big issue for our seniors. If it's a small repair, to try to get a contractor in for that small job. If it's a bigger repair, getting the funding to be able to help cover that cost. So we're working with them so that we can be that liaison between our senior and Habitat for Humanity, somebody that they trust with the Office for the Aging to get them together with Habitat for Humanity. We're providing them with information on what we know, what the percentages are, how many people need a new roof, how many need a roof repair, how many just need a small repair. We are purchasing grab bars for our seniors for in the shower, but we don't have anybody to install them, so to work with Habitat for Humanity to have them correctly installed. So
Yeah, and that's an issue, because we have the same issue. We've probably still got another 15 grab bars left, but we don't have any installers.
well,
Really
we can connect on that because Sabina is on the Habitat for Humanity. I met with her, and so we're working together on that to make it come together.
Yeah, so if you come up with a program for them to do that, definitely let us know, because we'll get another donation this year, probably 15 or 20.
Questions for Sarah? All right.
So I did not get my report in on time. However, I'll give you this as just talking points. And, could you do this instead for me? I have some data.
Oh, yeah. I forgot you did say.
We forgive you, Stacy. Do you need a motion for that? Forgiveness?
Yeah.
Anyway, I know. Sorry. Wonderful. Very patient. Next. So,
Yeah, next sheet I'll give it to her.
yes. And maybe if you see Tim.
Marty, do you know which one of the
I'll probably see you
ones you want? You know which one it is?
I'm not sure.
Those are the 4 documents I'd like.
Where you want to start?
You can pull up the CPS reports. But-
Yeah, okay, that's this one.
I'll start with the hard copy report I just handed out. I'm gonna also, during my personnel updates, the fiscal, financial management.
Oh, that's this one,
Yeah,
right?
the organizational chart, yeah.
You want that first?
Yeah, that'll be the first one I'll be doing. All right, so under the personnel updates, if you've not heard, Jeremy Balcom, my administrative secretary, is taking a new job in Albany. He's been with the Department of Social Services 22 years, so it's a big loss for DSS.
Big loss for you personally.
Yes, it really is. I'm really pleased for him though. It's a big jump in salary, and he is starting out where he get to in another 10 years when he's ready to retire from public service. So, it would have taken him 10 years here to get that same salary. He has a high school diploma, so the opportunities at DSS are more limited, and the job is office manager job, and after 6 months he can work remotely a few days, half his time. So it's really a wonderful opportunity for him. I'm very pleased for him. So what I'm doing is trying to move that position out of unions. It really is not a position that I feel comfortable. He has a lot of confidential information being in a union, so we're working right now with HR and with the county administrator's blessing to have it retitled and put in the management plan. I remember Jeremy coming to me once wanting to run for one of the offices. It's in Okta right now. And I said, oh, Jeremy, please, no. And it's just, as the commissioner, it's not, I'm clearly on the management team, not on the labor side. And we need to have those very strict boundaries in place. So that's in the
Where's the
works.
state classification for that? Reins are confidential, I believe.
It is, yes.
I mean, so
Yes.
there's
It
a
was never,
classification for that position. You could use that position, that classification, I would think.
yes, there is a management confidential written into, there's actually legislation that allows for what they call a confidential secretary to the
Yes.
Commissioner of Social
That
Services.
commission, I work with all our staff of that, all
Yeah.
the staff, the whole commission.
Yeah, it's important. With Jeremy leaving, he's had 2 part-time switchboard operators. We've always at DSS had live people answer the phone. We've got 2 part-timers, both retirees, and one of the gals will be leaving with Jeremy's departure. So that leaves me with 1 part-time, those are typist positions. We've had a terrible time trying to get typists across the department in all of our programs. So one of the pieces I wanted to get some feedback from you, I know we've been pretty committed to having live people because we do deal with, pretty emergent crisis-oriented situations. But many DSSs have gone to an automated, making sure there's kind of a worker of the day, if you will, in like our financial assistance, if it's a heat shutoff, and so there's a heating emergency, or if there's a crisis with a family whose children are in foster care, those kinds of things. So we would actually make sure, the message would be very clean about press 1 or 2 or 3. I am without any real opposition by you folks. I would like to explore making that shift, basically just due to staffing, not being able to recruit folk. So, so again, we would move out of that. I would then take that other part-time typist, who is a real bright gal. Again, she's a retiree. She lives up in Pulaski, does not want to come when it's storming. So that could make it very tricky as far as something like a switchboard, because then we have to find backfills, which we've been successful doing in the past, but now I don't have positions filled that usually would backfill the switchboard. So those positions are vacant. So I'm really looking at taking that Gail and using the time she may want to devote to us in our accounting department. And as you can see, we're down now 42%. I've got 7 vacancies out of the 16.5 positions. Those are the shaded ones. And then the blue and shaded one, that community services worker, that's a temporary gal. She's a college student who's come in to do part-time. So I don't really consider it filled, although she's pitch hitting part-time for us right now, but that is a full-time position. So with 42 positions vacant, I just, wanted to make sure you had a heads up. If you want to push that up a little bit, you can see
Go to
the narrative there.
bottom.
Yeah.
You want it all on?
No, that's
Okay.
good. Just like that is good. So, basically we're moving about 39 million through our DSS budget. That's aside from Medicaid. That's aside from mental hygiene. Nicole, a lot of that's just passed through money. So she's passing it through to our vendors. And our employment and training, WIOA shop has a senior accountant and an account clerk just separate and in the Fulton office. But it's a lot of money we're moving through, and I don't know if anyone here We did a fiscal presentation once a while back. I'm always happy to do that, so that you can just see how complicated and convoluted these claiming systems are. They have to be coded, and there's different ways each one of our funding streams allocate costs. It's not an easy system, and I just need to make sure you understand, without filling these positions, we really are not keeping current. And we risk lost revenue from the federal and state government if we pass claiming deadlines. We're doing the best we can, but it's with 42% positions vacant, you can appreciate this is really hard keeping all the balls in the air, so to speak.
One question, Stacy.
Yes.
On the accounting side, what is the requirements for the person applying? I mean, what are they required to have?
So for our account clerks, they have a high school diploma and 1 year of experience in some kind of, it could be a cashier in a store. For typists, that's no experience needed, right, Marty?
High school diploma.
High school diploma. The issue really, we have had some typists come and go very quickly, but the schools pay more. They tend to go off to school districts that are close in their neighborhood, and they, as I said, they pay more. So pay is really an issue right now for us, getting somebody seated.
And when you say they have to learn the codes of the accounting group, is that similar to like billing for hospitals or doctor's offices and things like that?
Not knowing those systems, I'm not sure. What I can tell you is it is very complex work. So for the people who are doing those kinds of higher level, that would be our principal account clerk. The account clerk series, they call it. Typically, these are all promotionals. So like our principal account clerk, Sophie, that does a lot of that stuff, really higher level. She started as account clerk, became a senior, and then went to principal. So often they kind of move up the ranks. So if we can't fill those account clerk positions, moving them up the ranks becomes kind of null and void.
So are these the type of positions you can consider hiring 2 part-timers instead of a full-timer?
Some of them we could get away with that, some we can't.
Okay.
Yeah, and we actually, this part-time account clerk, she does not want to work full-time. At one point, that was a full-time position, and we pushed it down to a part-time position. And she does a great job for us part-time. So we are a big proponent of job sharing, especially working moms. Sometimes we'll want that job sharing situation.
I'm kind of thinking more in the idea of seniors, because there's a lot of seniors now that are considering going back to work for part-time. And there may be quite a few people that would meet that qualification. I mean, we've done it with a couple positions and it's worked out very well.
Yes, I would be thrilled if we were given anyone to interview.
RSVP.
We're hiring basically provisional, so when these tests are given, most of the people taking the civil service test, at least for us, are the people who have been seated provisionally for quite a while. Marty, do you want to talk about civil service and our social welfare examiners who took their test in May?
Yeah, so the social welfare examiners in our shop, we've created possibilities for even our community service workers to be able to promote up to a social welfare examiner position. And very often we would bring in typists who promote to CSW, who promote to social welfare examiner, all within the time that they're still provisional. So they're not getting credit for any of the time that they have held any of those positions. So it's just like they came in off the street being hired provisionally as an examiner. So their examiner test happened in April, and we finally got the results just at the very end of October, beginning of November.
It was
So
2
people
weeks
had been
ago, yeah.
provisional for a long time.
But what happened was the state, they scored that test and put the list out. And it took them so long to score it, the next social welfare examiner test was gonna be given. And because we didn't have the scores and didn't know if they had passed, HR said, you better have them all take the test again, just in case when the scores come out. So giving up a whole Saturday morning, being there at 8 o'clock, because the scores thankfully came out right in the nick of time.
Yeah.
But that's the kind of angst our staff feel, because usually in the private sector, right, you get a job and, maybe you're on probation, but you got the job if you perform well. That's not the case in us competing with the private sector and government. We're provisionally appointing these folks, hoping, please, let them pass that test. And thankfully they all did, right? All of them passed.
I mean, if you've got these positions and you can look at the other spectrum here, with seniors, I mean, RSVP, OFA, they could be putting out, letting people know there are part-time positions that, that's pretty much minimum requirements. You gotta take the test, I get it.
Right.
But you're talking, high school education, background, take the test, you're in there 20 hours a week, whatever.
We'll hire them provisionally. We won't even wait for the test to be given.
I think that we should, if that's,
We're out at all the job fairs. I mean, we haven't done the RSVP newsletter. We haven't done that. We could.
I don't know if you can with RSVP because it's volunteer.
volunteer,
If you're getting paid, then they probably cannot promote it.
Gotcha.
Because we tried that with our high cap.
did you with,
One of the
okay.
big
I
issues
know
with
that you folks were generous, I think, in providing for HR to have additional monies for next year's retention recruitment. So I'm hoping that HR will come up with some creative ideas. We are already at every job fair. We are already going into all of the schools, especially SUNY Oswego. We are already really trying hard to get students to do internships through community college, human services. We at DSS are teasing time out to, although already overwhelmed with our basic responsibilities, to try and recruit and bring people to our doors. It's just not an easy lift right now, Jim. I wish it was. I wish I could get people, because this is what is happening. It happened also in our investigations, as I bulleted here. We'll soon have 2 vacancies. Mileage reimbursement is a real issue right now. It's not keeping pace, depending on someone's vehicle. The last one leaving is actually demoting herself back to a social welfare examiner, which is where she was, because she's got a big truck and it's just not feasible for her to keep up. And then the other guy was fabulous, but the sheriff pulled him, and he's going to be working as an officer in a school. And they've apparently waived how much extra you can earn in order to get these deputies into the schools. So Herb had actually talked with me about being out in fraud investigations when he was at the sheriff's. So I am going to have a conversation with the sheriff about that. I've already had conversations with the sheriffs about embedding some of his deputies in the services with our caseworkers, child protective investigations. So it will be easy to just add on to the contract we have. But he really needed a little time to get people out in the schools first. And it's not been easy for him either, to recruit all these folks. And of course, as you know, COSAR is picking up that cost. And it could do the same for our folks, as far as it wouldn't be a free ride, but 75% of it could be covered. So, especially in our fraud investigators.
And there's always that nice information the state shared with us the other day. It was recruit against us.
Was that just the most discouraging thing? So now the state's strategy is to have one big exam what do they call it?
Professional services.
Professional services exam that would cover numerous different positions and wanted me to recruit for this big exam that they take online. Just pull it up online and take it. That starts people in the 60s and they get up into the 80s within 2-3 years.
Share it with our staff, they said.
Yeah.
Delete.
And I'm in the
What do you
chat
do with your
box.
spare time?
I'm in the chat box saying, you are undermining our local districts.
Yeah.
We already are having a staff shortage. Yeah. And lastly, on personnel updates, since the last time we met, we've got 9 more caseworkers walking out the door. 9. And we welcome 2 today. I don't know as I need to say more than that to you. It's not safe. Department of Health vehicles, brought to my attention by another DSS person that knows some folks in the health department that they're looking to sell 4 county-owned vehicles, very low mileage, that were in hospice. So I've reached out to purchase those vehicles next year. I know I can't do anything yet this year, and we can receive state and federal monies, reimbursements for those vehicles. So I'm having our fiscal officer look into how that would work, but
Rich has got a comment, I think is what I'm gonna say.
Yeah,
Go ahead.
I don't know, number one, if the county owns a vehicle, it can be assigned to another department without a purchase.
Right.
2, health may have acquired those using Title VI monies or other monies, in which case I don't know if we've already claimed reimbursement on, we can claim it again through your district. So I mean,
they're old vehicles.
yeah,
so
the
I thought-
legislature controls the property of the county. They can assign the vehicles that are no longer needed to health, otherwise eligible to another department.
Well,
We
they
had
were
one
gonna
that
sell
was,
them.
yeah, we had one that was broken into over the weekend with the console ripped out and windows, so we're getting that fixed. So I don't know if that was a hospice vehicle or a health vehicle. We can talk more about that. We wouldn't have to do anything with the title, we just reassign the vehicle to your department.
We would love that, but that would be very helpful for us, both with our caseworkers who right now use their own vehicles, as you know, and our fraud investigators who are really hurting as far as being out on the road so much. So we would love that. I was not able to get clarity from the gal who does the fleet. They have a senior accountant that manages their fleet there, and
Yeah, and you need to get that because hospice, I think all of the hospice vehicles are leased. It's the other ones to health department that I
I
think they
was told
still
they were
own.
owned vehicles and they were gonna be sold.
Well, the other thing with hospice is the RFP, I don't know if they're listed as assets of hospice on the RFP that is going to be awarded. So check with us and check with purchasing, but generally if they're owned by the county, they can be assigned to another department without a problem.
I'm
Who
just
makes that
telling you
call?
what I was told, that they were gonna be sold.
Who makes
and I
that
had to
call?
buy 'em.
Legislature.
Yeah, we
No,
did.
I know that, but who's the overseer of the cars?
The senior accountant at Public Health. That's who told me that she'd have to talk with Vera, but Vera was out that week and then Cheryl's out this week, and so I'm just waiting with bated breath.
I mean,
I
if
would love those cars.
Yeah, if they're not being used, we're paying insurance on them anyway, they're all registered, you know.
Yeah, I'll take those keys. Love it. If they do have to be sold though, I also can get reimbursement if that's allowed. Transportation, I just thought I'd make mention, that VTC dispatched in the month of October rides for 209 DSS services clients. Most of them are foster kids and parents of children in foster care. That accounted for about 1,200 trips, and they used 18 volunteers to complete those trips. So if I have someone up in Jefferson County at the children's home up there, they use a Jefferson County VTC volunteer, bring them down here, take them back up, and that's been working really well for us. I hadn't really reported out on how well we've been doing with our dispatch center and with the use of volunteer transporters. So just wanted to give that little highlight to you. Foster care rates, you heard me complain, I guess, about the state and how they're handling foster care reimbursement. Basically, again, another place where they're pushing away from the table and saying, not us, we're not going to be the ones responsible for this funding. We don't want kids in foster care anymore. We won't pay for it. And they've shifted the way they are paying our providers. And so good for the Council of Family and Child Caring Agencies. So these are like Elmcrest Children's Center, the House of Good Shepherd, all these residential facilities, they're all under COPCA, and they are suing the state and saying no more. So there is a little more of a write-up. I just kind of cut and pasted it out of a brief I had gotten for you. And I am cheering on COPCA because this is just crazy that they're not looking at actual costs anymore. They just shifted the way they're going to look at reimbursement. You may recall I've already said they've closed down so many facilities that we are bearing the burden of kids with severe complex care issues, kids who should be under the OPWDD or the OMH kind of umbrella that are not appropriate kids for child welfare. But we are the safety net for all citizenry. And that means sometimes I've got one, possibly a second one, that's going to have to go out of state because they've been in the hospital. The one gal was in the hospital, 13 years old, for 6 months before we could find a placement for her, and she ended up in Massachusetts. It is unconscionable what the State Office of Children and Family Services and the Governor's Office are doing right now to us. I am still looking for a nurse practitioner. I'm still looking at contracts. It's not been successful. I do see where a resolution was passed for a nurse practitioner out of public health. I'm going to reapproach public health. I had approached them before. They weren't interested in partnering with us for our medically fragile kids with child protective investigations. I'll try again. This is a tough sell though. And we've had a lot more, and one of the things I've noticed, we've had a lot more failure to thrive babies, itty bitties, in the hospital, and docs don't always want to say it's the home environment, and they certainly don't come out of the hospitals to go in the home. It's on us at Child Protective. So I know that these are children failing to thrive because of parents with severe substance use issues. And you can see that in our data. Let's go to the data set for CPS. Because of our workforce crisis, or what I'm calling kind of beyond crisis now. So this is a percentage of workers. We're more than 15 CPS investigations. Remember, they're only supposed to have 15. We've got people with 20, 30, 40 cases now. If we go all the way down, because you can see it's all the counties, keep going down, 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 down. Keep going. There is Oswego at about half of ours. And the only reason the other half don't have more than 15 is because they're so brand new. Some of them have 15 or less. Next page shows you, you've seen these charts before, our overdue investigations. And so how many of the reports we have that are overdue, keep going down, down, and there you'll find towards the bottom there, Oswego, so at about 55%. And then the next is our percentage of timely safety assessments. So we have to ensure safety within 7 days. And again, you can, with this slide, you can go all the way down to the bottom because we're dead last in the state now.
So do you pick, when you have charts like this and it's telling you information, do you pick like this one for, what's this one's child safety? Do you attack that to try to drive that number down? How do you? To drive it up,
to
actually?
drive it up.
How do you attack that to make that
We
better?
have to hire people. The only answer right now is getting people into
So
positions.
getting bodies involved is the only answer.
You have to have the bodies to do this work. And right now, they are hurting. We just, we can't keep up. You know, when you have, over the last 2 months, 9 walking out the door and 2 hires, we just keep getting farther and farther and farther behind. Foster care, we can take a look, like the care, yeah. So you can see, we're doing a little better with foster care. I don't know how they're doing it, God bless them, because they have really high loads as well. But you can see what we do here is we look at 4 months in 2021, and then the last 4 months in bold are 2022. So we are, in fact, bringing down some foster care and getting kids home. Although the number of kids, as you can see, the number of children that are up at that 24 months or more, that has also gone down a bit. And that's because we got 30 kids free for adoption and adopted out last year. And we're probably going to be on that same trend. I'm trying to get our 4 attorneys together in one room to talk about our 5th attorney position. And I just can't seem to find the time because they're like constantly in court. It's been really difficult for me to get them. Basically, we can do virtual. That's about the best we can do. I can't get them all in one room at one time. We've just been slammed with emergency removals. Much of those removals are due to substance use disorder. So that takes us to the start. And that's that one, yeah. So I'm ending on a positive note in this last committee meeting of the year. And the hope here is that we can keep, especially these babies, you know, when we interrupt that bonding and attachment, it is really bad for kids. And so what START, if you recall, I've given you lots of information on START over this past 2 years. Is for kids under 6, and it's for kids who parents have a serious substance use disorder. It is a disease. It is a brain disorder. It is treatable, and so there's hope there. We just have not had the appropriate services to wrap around our families here. So R3 is actually a project where they're looking at the evidence on use of recovery coaches or family mentors for outcomes for families in the child welfare system. And it's authorized under a federal 2018 Support for Patients and Communities Act. Next slide. Our project team is the Ad Associates. And they've actually selected START as the National Training and TA Program out of Children and Family Futures. That's the folks who give us our training and technical assistance. Oswego rocks. We are on the cutting edge. We are the first in New York State. You might recall we provided a workshop at our NIPL conference this past summer. We had state people there from Office of Children and Family Services. In a recent conversation, she said to our Director of Services, I want to see this go statewide. And now the feds are putting lots of money into University of Michigan, Portland, Child Trends, and they need to have people like us that are just getting our projects up and going for a 5 to 6 year research project. Next slide. And so START nationally was selected. And so they're engaging with us, and it includes new and well-established. Most of the well-established sites are in the Midwest, particularly Kentucky. And so they're particularly anxious to get connected to us, although last week, Wednesday, we had a virtual meeting, and we were really being interviewed. How about this? How about this? How about this? So I was able to kind of talk them through and let them know that New York State as a whole has always invested in research. Next slide. So there's study components, impact evaluation. We talked about the design of the outcome-based research and what that would look like. I want to thank you again for giving me a couple of extra grade B supervisors, because that's the higher level that we'll need. And one of the very cool things about this is it comes with money. So if I want to get a second CERT team up and running, next slide, then that may be something that would come with us participating in a national level federal research project. This is what will keep me going, I can tell you that. The bureaucracy of what I'm dealing with mostly lately has not been all that thrilling. But this I get jazzed for. And we can actually make a difference at a national level as well as at a state level, and more importantly to me, for those young children in Oswego County whose parents are losing their children because we're not giving them enough supports. So it's pretty cool stuff. I think there's maybe just one slide left. Oh, no, 2 slides left. Okay, so that's our potential evaluation timeline. So we'd be looking past 2027. You know, there's a lot to this. We would have to look at, you know, what can we provide for data, and we would be working a lot with New York State OCFS. And I've been a little cranky with them lately with some of their decisions. So I'll let Marty and our Director of Services take that role. Next slide. And there's our points of contact with ABT. And those are actually Kim and Victoria Wheat were the 2 that we met with for the first time last week. But stay tuned, more to come next year. It is quite exciting, and I gotta tell you, it's exciting for our staff, for our caseworkers, for our senior caseworkers, the supervisors. I've included people so that they had hope, they had vision, they're excited by it, and that also is very cool for me as a leader. So there we are.
Any questions for Stace? All right, I'll look for the appropriate motion.